I think the biggest obstacle facing our healthcare leaders and decision makers are our conceptions of the healthcare system. Healthcare is an enormously complex enterprise that involves lots of different players at many different levels, trying to do the best for lots of different kinds of patients with many different conditions. In big, messy, complex systems, you have the deeply held beliefs at the top of the system that drive the system, but also are the ones, if you can change those deeply held beliefs, that have the greatest impact on transformation of the system. At the bottom of the system, or the bottom level, are the kind of the fiddly bits, the constant numbers and parameters, the individual organizations, the things that you can do on a small scale. Most of our evidence, most of the way we think about the system is at that lower level, and yet we have really important deeply held beliefs about the system that make it difficult to change. For example, Canadians think they have a great healthcare system that delivers great outcomes. If we look at ourselves in comparison to other countries like the US, Australia, New Zealand, other Western countries, we're number 11 out of 12 countries that were surveyed by the OECD that looked at multiple metrics around care, quality of care, the return on investment, those sorts of things. We're not at the top of any of the indicators. That's a deeply held belief that makes it difficult to change the system and difficult for our leaders to be given the support to change the system. I lead an organization called the Michael Smith Foundation for Health Research. We support health research, and I think our goal is to really help the health system transform by bringing the best available evidence and collecting the best evidence that we can during transformation to really help that change occur. So we want to be an integral part of the system. And right now, health research is often thought of as that thing over there, that extra thing that we do if we have extra amount of money, instead of thinking that research, R&D, is an integral part of the system itself and really transforming the system. So my goal is to help show and deliver the evidence that can help the system transform. Well, it's certainly clear that the development, the rapid pace of development in technology across a whole range of aspects of healthcare will drive change, whether our leaders in the system want it to change or not. And so I think that's a really important component. And it's almost hard for those of us who are sitting here today to imagine what that looks like in 5 years. But we're putting a lot of power through digital health approaches in the hands of the patient and the family. I think that will drive change, and I think the opportunity to incorporate technology into the way we understand patient needs, the way we deliver care, the way we organize the system, the way we learn from the system, there's just huge opportunities, and we need to be able to take advantage of those opportunities. Where we're headed, for example, with technology is so critical that we need to build the relationships that enable us to work across our sectors and what tend to be silos. They're not all silos. So the Healthcare Summit is a great place to meet individuals who work in other parts of the system, who deliver services and supports, who face the problems from the point of view of government and the health system. And so I think those are great opportunities to either start or advance relationships that are at the core of advancing in a complex system. So the complexity of the system demands those relationships, and that kind of summit will help us build those relationships.